Despite concerted efforts by the federal government and donor agencies, Nigeria ranks the second largest country with global burden of HIV/AIDS, contributing the largest percentage of new up and down attained HIV infections among children. In the special report, our correspondent Gloria Kiba takes a look at the importance of knowing one's status in reducing HIV burden in Nigeria.
AIDS affects business, employees, market and productivity across the world, and so there is a need for everyone and the world leaders to turn their attention to the issue of the increasing impact of AIDS, especially as it affects the nations. The statistics presently available are terrifying given the level of awareness and interventions across all boards to ensure a drop in the number of new infections recorded in the country. Based on global statistics released, no fewer than 1.8 million people died in the year 2017 from HIV/AIDS-related disease. About 37 million people are presently diagnosed to be living with HIV/AIDS, while 9.4 million persons are unaware of their status in Nigeria. About 3.1 million people are said to have been diagnosed and living with the disease, of which 200,000 persons were newly infected in 2017 and 150,000 persons died. More data also shows that the reason behind these new infections is not far-fetched from the huge number of persons who are unaware of their status.
I do my own every 6 months. I used to do my HIV test so that I will know my level.
You know, say this thing, sometimes they get time for another road. This road, if you say some people go think say now to use woman and man, now you go get them.
30 years after the first celebration of the World Acquired Immune Deficiency Syndrome Day, the position is still dismal for Nigeria, which happens to be the second largest country with a human immunovirus HIV in the world. Rather than trickle down, the different figures springing from different findings continue to escalate, and more worrisome is that the actual figure of persons living with the virus cannot be ascertained presently until results from the ongoing National AIDS Indicator Survey is completed and made available in the public domain. Recent investigations have tagged religious beliefs, stigmatization and fear as major reasons for the lackadaisical attitude responsible as why many people shy away from running a HIV test even though it is conducted for free. And what these Nigerians fail to understand is that not knowing one's status hinders winning the fight against HIV/AIDS, because these have an effect on the infected person, close friends, relatives, associates, the economy, nation's productivity, and the world at large.
There needs to be more awareness of the reason why you need to know your status, because not knowing it is health risk for yourself first of all. Now you will not be able to take the necessary medications you need to take.
To achieve a world free of the virus, the Joint United Nations Programme on HIV and AIDS, UNAIDS, have set a 90-90-90 target with a view of addressing the HIV burden. It is expected that by the year 2020, 90% of people must know their HIV status. 90% of the total number of persons who are diagnosed to be living with the HIV virus should be placed and receiving a sustained antiretroviral therapy, and 90% of people receiving antiretroviral therapy must have attained viral suppression to ensure eradication of these diseases by 2030.
We're targeting about 90%, we're still about between 30 and 40%. So we've made some progress, but we're not quite there, and there's still a lot of work to be done. And this is especially important because we're looking at 2020, and when you look at a lot of states, a lot of countries, and Nigeria carries one of the largest burdens, so that they've left us behind and they're making a lot of progress. So the whole world is looking at us to see how we can really improve our own coverage so that the global targets can be met.
If Nigeria must achieve the 90-90-90 target, everyone must take the first step to know his or her status. Only then will Nigeria meet the first 90 targets by 2020, and this means that Nigeria has a lot of work to do. Gloria Kiba, Court TV News, Abuja.